How to manage cramping and bleeding after a cervical colposcopy. After undergoing a cervical colposcopy, it is common to experience cramping and vaginal bleeding or spotting. These symptoms are generally part of the healing process and can vary in intensity. Understanding how to manage these symptoms can help ease your recovery. First, expect variable bleeding and discharge. You might notice bleeding starting right after the procedure or even up to a week later. This bleeding can last from a few days to several weeks, sometimes up to 4 to 6 weeks. Typically, the bleeding is light to moderate and may resemble a lighter menstrual period. You might also see black specks or watery discharge, which is normal. It is common for the bleeding to stop and start intermittently during the healing phase. For cramping relief, mild cramps similar to period pains are expected and usually last about 24 hours after the procedure. Over-the-counter painkillers like paracetamol can be effective in relieving these cramps. Maintaining proper hygiene and following activity restrictions is crucial. It is advisable to use sanitary pads instead of tampons for at least 3 to 4 weeks to minimize the risk of infection and irritation. Avoid vaginal douching or inserting any products into the vagina during your recovery. It is also recommended to refrain from sexual intercourse for about 4 weeks to allow the cervix to heal properly. While you can shower or bathe, avoid swimming for 2 weeks after the treatment. Additionally, limit heavy exercise, running, or activities like yoga and Pilates for 3 to 4 weeks to reduce the risk of increased bleeding. Monitoring your bleeding is essential. If you find yourself needing to change a large or maxi sanitary pad every 2 hours or more due to heavy bleeding, contact your healthcare provider immediately. Seek medical attention if the bleeding lasts longer than 4 weeks, becomes heavier than a normal period, or if you notice any foul-smelling discharge, which could indicate an infection. If you experience severe pain, fever, or other signs of infection, reach out to your doctor promptly. Keep in mind that your next menstrual period may be heavier or longer than usual, but it should normalize within a few months. Healing times can vary depending on the extent of the treatment. Minor procedures may requiring less recovery time compared to more extensive treatments like loop excision or laser therapy. Summary: managing cramping and bleeding after a cervical colposcopy involves rest, using safe pain relief methods, maintaining hygiene, and monitoring for any signs of complications. Always follow your healthcare provider's specific advice and do not hesitate to contact them if you have any concerns or unusual symptoms. This approach aligns with established medical guidelines for cervical cancer screening and treatment, ensuring a safe recovery while minimizing risks.